Now what it is called breast cancer. What is the definition of breast cancer? Before we discuss about this breast cancer, we should be familiar with anatomy of the breast. What is the function? It's a milk producing gland, correct? And that is connected with connective tissues, and you see fibers and fat tissues and blood vessels and nerves and lymphatic channels. It is supported by all these parameters. So that is the breast, anatomy of the breast. Now how it develops in the breast, particularly this breast cancer develops in the duct, that is milk producing gland. Initial stage you can't judge, you can't predict that cancer is there, but yeah, if you do some screening like mammography or self breast examination, that is very important. But women should learn self breast examination by her physician, and that physician should instruct the woman that semi-annually or once in a month how she should examine her breast, in which position. That is very important, particularly in reclining position. You see, reclining at ease, I mean when you sit on that massage chair, when people are sitting on massage chair, that is reclining at ease and comfortable, and you can check the lump or the size or nodules, whatever is there, you can see that size. And now what are the symptoms? Initially you can see lump, but if you do mammography, then you can see exact where it is. It is not painful. Initially stage it is not painful, but gradually it develops. I mean when tumor develops, then it is painful. Some pain or tenderness is there. After menstruation, I mean the patient should check her breast after menstruation, not before menstruation, so that she can feel the hardness or some tissue, I mean some over there in lump in that breast area. Sometimes I mean that you can see that breast is pitted, that skin surface is pitted, and it's like orange color. Surface is like orange color. That is advanced stage. It develops in the advanced stage. But initial stage it is not detectable, and nobody can say, yeah, that you have developed this cancer. Gradually, when it reaches at advanced stage, that is called metastatic stage. At that level, patient can feel, yeah, that something is wrong. Some discharge coming out from the nipple, or some texture or some temperature. You can see different types of, prominence over here. So these are the main symptoms. There are several types of
You
breast.
said orange, that is color,
Yeah,
or
color,
also changes?
orange color.
Color
Orange.
changes.
Yes. That is advanced stage.
Advanced.
Advanced is pitted surface. That pitted, what type of pitted is this type of pitted surface?
Okay.
Surface. That pitted surface and orange color. That color of that breast is orange color. It means it is now progressed.
There must be retraction of the nipple also.
Yeah, retraction of nipple is also there. Some flattening of the nipple you can see. And some types of breast cancers, that is invasive ductal breast cancer, some nodulous ductal, and some inflammatory stage. But initially, first two, that is treatable condition, because that cancer is located in duct area. It has not spread beyond that. So in that area, it is treatable. If it is detected early, then it is treatable, and if it is not detected, then it is not treatable. Right? So what are the risk factors? Risk factors. Which risk factors are increasing the risk of breast cancer, particularly gender? Women. Any women who has crossed 35 years, I mean beyond 35, she is more prone to develop this breast cancer, right? That is the main. Men have very less. So 1%, hardly 1% men can develop this breast cancer, but women are more prone to develop this. That is gender, age after 35 or after menopause, after 50 or 55, chances are more, 2 to 3 times risk factors increasing. Because you see, after menopause, the ovaries shut down and it produces more and more estrogens. So that estrogen affects the fat cells, and that fat cells triggers. So that is the main risk factor. That age. Second is this genetic factors, that is also responsible. Family history is responsible. 90% is genetic factor, 10% is family history. If father side or mother side, anybody has, any women, father side or mother side, if they have developed the cancer of breast, then chances are more, right? Particularly then again is race. White women particularly, not African American women, but white women, they are developing more breast cancers. There is some reason which factors are triggering, that I will come to later that point. Then dense breast tissue, hardness that is, breast tissues, hard tissues. Menstrual period. What is menstrual period? If a woman develops this menstrual period early, before 12 years, then the risk factor is higher, right? So this is the main factor. And after menopause, after 55, if that period is continued till 50 or above 50, then after 55, chances are more to develop this cancer. Again is breast radiation. If she has taken any radiation treatment earlier, then she can develop breast. History of breast cancer is also important. If she has developed breast in right side or left side, then again, it doesn't mean that you can't spread here. Yeah, it can spread both the sides. So these are the risk factors. Now, who is at risk? Which women? Particularly, Mumbai statistic says that out of 30 women, one woman can develop in a lifetime period. Out of 30, this is current scenario. But after 10 years, it will double up. Means per 1 lakh population, 60 women, they will develop this breast cancer after 10 years. So this is and what is the size, tumor size? Average tumor size is 2.5 centimeter. Earlier it was 6.5 centimeter, now it has come down. So it is 2.5 centimeter size of tumor that develops in the breast. Sometimes it is painful, sometimes it is painless. So many years you can't see that pain and you see discharge and all everything. But yeah, after a certain period of time, you can see. So that's why this self-breast examination is very, very important. And each and every woman should learn this technique. Sitting position or lying position, she should do on her own. In a relaxed position, keep hands down and stand in front of mirror and check the breast and nipples and see the discharge, which type of discharge comes out from the nipple, whether it is bloody or it's you see a purulent discharge, there is pus formation sometimes comes out, or sometimes it's a totally clear discharge. But she should check every month. Every month means every month. And mammography every year. After 40, women should check, go for this screening mammography. It is very important. It costs 1,500 to 2,000 rupees. So it doesn't make any difference yearly if you go for this mammography, then it's okay. But self-breast examination is very important.
See, this self-breast examination,
Yeah.
we should systematically palpate
Yeah, systematic palpation. Yeah.
the palpation. They would be in a position to feel the change in the consistency of the tissue.
Yeah, yeah.
And if they can feel the change in the consistency of the tissue, then only they should go for the mammograph.
Yes.
The mammograph itself is an exposure to radiation.
Exposure to it, and it again it develops.
So,
Yes,
it
yes.
will be better.
So
that-
best way, you learn that technique from your physician. So that will make a lot of
And
difference.
it's not difficult.
Yeah, it's very easy. I mean, not difficult. You can stand erect in front of the mirror and check. Every month you should do after menstruation now, but not before. So that now poses. Which poses? I mean, which causes are triggered? Obesity, main factor, fat cells. Now, obesity after 35, I have observed so many fatty women are visiting, and there are more chances to develop this cancer after 35. And what she should do? She should eat balanced diet. She should stop smoking if she is smoking, limit the alcohol, and regular exercise. This is very important factor to reduce the risk of breast cancer.
Non-veg food.
Everything, yes. Avoid.
But it's fat, animal fat.
Yeah, every fat that should be minimized. I mean, it should be mild, I mean, quantity, not moderate or big quantity. So remember this point.
Marriage, breastfeeding and all this thing, does that have any relation?
Yes. See, breastfeeding is at least 1 year. If women gives to her child, then chances are very less to develop this breast cancer. There is a relationship. So before, if she is menstruating before 12 years, then risk factor is increasing. But yeah, if breastfeeding is there regularly 1 year period, then very less chances. So that is also connected with this. Another point, there was this story. Okay, all these things I have discussed now. What precaution should take to avoid that cancer? Particularly, see, women are wearing, bras, very, tight. So, on the chest wall, it gives a lot of pressures. When your bra is not, in proper size, then it affects the chest wall. It always develop there. So, you should remember that factor also. That factor is also responsible. So, garment should not be that much tight. So, you should be, according to your size and that measurement, check the measurement. Then the technique I mentioned it first. Now you can see sitting and standing both the position. Sitting position, see the breast. Standing position, see the breast. But stand in front of mirror, otherwise you can't see. And reclining position, and like sleep on that chair, massage chair or whatever the arm chair, you can lie down and you can check palpate both the sides and see the difference of the both side of the chest. Now, management factor. Before talking about Ayurvedic management, I wanted to say something about modern side, that is chemotherapy, radiation therapy, and surgical mastectomy, radical mastectomy, that is removal of breast. It's very shocking for women. So, women have a lot of fear, and particularly when she developed this breast cancers, fear in the sense, which type of fear? Disfigurement, disability, then dependency, disruption of relationship, and death. These 6 Ds are fearful for any type of cancer person. So, what we have to do, because there are a lot of side effects of chemotherapy, they don't want to go for. Chemotherapy side effects, nausea, vomiting, alopecia, loss of hair,
Yeah.
fatigue, and delayed toxicity of myelosuppression, the bone marrow suppressions. That is the delayed toxicity of chemotherapy. Loss of repeated. So chemotherapy is always dangerous. Treating cancer, I mean symptom wise, if you treat symptoms, but this treatment is more painful than symptoms. So here what we are doing, we are giving some good remedy, particularly to avoid all type of chemotherapies and radiations, bad effect, and permanently it subsides. So one Aule is there, that is Rasayan Aule. This is, remove
This can be taken as a preventive also.
yes, preventive. See, if patient is on chemotherapy or radiation therapy, side effects, see, all the side effects I told you, chemotherapy and radiation. Because these are the side effects of that, both the procedure, chemotherapy and radiation. So to avoid the side effects, you have to take Rasayan Aule. It contains so many immunomodulating drugs like Ashwagandha, Shatavari, Yashti Madhu, Pippali, Ashwagandha, Shatavari. These are the drugs. Pippali and Amruta. Ghee and honey. See, you can mix it together, make it like paste, like Chyawanprash. Same form of Chyawanprash. You can prepare at home. Ashwagandha, Shatavari, Pippali, Amruta, ghee, Yashti Madhu is there. These all are enhancing immunity and avoid all the chemotherapies and radiation side effects. So this Rasayan Aule, at least 30 grams daily in the morning, you can take. 30 grams up to 75 days you can consume this Rasayan Aule. These are the herbs Ashwagandha, Shatavari, Pippali, Amruta, ghee and honey. Yes, Madhu and honey. Here you put honey. But proportion should be,
Part.
yeah, ghee and honey. And make it like Chyawanprash, that form, and leak it. 30 grams with milk. 30 grams with milk. This is number one. Avoid all type of radioactivities and chemotherapies, all the side effects. Subside this nausea, vomiting, improve the appetite, remove the fatigue, and even regrow that hairs and all. So loss of hair is always there. This
After people,
Pippali,
इसके बाद
Amruta, Gilo, Giloi, Amruta, Giloi is called the Gilo. That is Giloi. Ghee, pure clarified butter, Yashti Madhu. That is called Techi Madhu and honey. Right? This is available, all these herbs are available, honey and ghee. Make it fine paste, 30 grams. Second is Tishtha Kashaya. Narsasindurum extract. Extract is 1 gram, only 1 gram. With money. 1, 2, 3, and last is Sanjeevani oil. That is for local application. Sanjeevani oil for local application where swelling and pain is there. Just apply for local application. These are the drugs which you can give freely in breast cancer patients. Even in advanced stage, it gives wonderful result. This is the management and cure, prevention, prolongation of life, and improvement of quality life of the patient. So these all are very important. All these products. See, these products are not available at Ayurvedic shop, but this is Keralian preparation.
But all this effect is in
Yeah.
first stage. It is
First stage is first stage, second stage, up to second stage. Yeah. But all this medicine you can continue at least for 3 years, 4 years period. Along with this,
Like
yeah. Gold Bhasma, that is called Suvarna Bhasma. Suvarna Bhasma, 62.5 milligram to 125 milligram with honey and ghee. And this Tamra Bhasma, you can give, Aprak Bhasma you can give. All the metallic preparation, you can give Aprak Bhasma. 10 gram with all this herbal preparation. Even if you want to add Dirak Bhasma, that is also good. Dirak Bhasma. And Rajat Bhasma is also there. Suvarna Maksik Bhasma is there. All 10 gram, 10 grams, 10 grams, 2 times a day. This is 1 gram. This Dirak is 1 gram. 2 times in a day, honey with ghee. 1 gram, 10 gram, 10 gram. Mix together and take with honey and ghee. All this. This is very costly. 1 gram cost around 8,000 rupees. This will cost around 5,000 rupees. 1 gram cost. And this is cheaper, this is cheaper. Main these two drugs, Bhasmas, effectively working on all type of cancer, not breast cancer, all type of cancer it works. It's a marvelous result if you take Suvarna Bhasma for longer period, no recurrence, nothing. It will prevent this cancer forever. These are the remedy management, all this Gautam Kashaya, oil, and this. Alright.
In some of the cases, I have seen even one of my relative also. After developing a breast cancer treatment, she went to foreign, took treatment and all this thing. 3-4 years she was perfectly okay. Then she developed the leukemia.
Leukemia. Yeah.
This I observed for 1 or 2 more patients.
Some risk
So is
factor.
there any relation?
Yeah, it develops because this is what is the root? Root is that from lymphatic channels.
Ah.
So it spreads. Yeah, it spreads in the body. If you develop this breast cancer, it goes into this bloodstream.
That's to the
Yeah, it
leukemia.
develops, leukemia can happen and increase this white blood cells because it,
Because 3 to 4 years,
yeah,
years she
so
was
you
okay,
see,
perfectly.
WBC is always increasing in that leukemias.
Yes.
So that is low immunity. So all the drugs I mentioned, that ashwagandha, shatavari, estimado, that improves the immunity. So you can take this as a preventive measure. All these products, this is available at market, medical Ayurvedic shop. And you can take this. And all the side effects, chemotherapy side effects, radiation side
Yeah.
effects, this side effect minimize.
And subsequently,
Yeah.
bone marrow and all this, or
Yeah,
transplant
it
was
always
done.
suppress, yes.
Yeah.
Right. This is acceptable that this Ayurveda will minimize or avoid the side effects of the chemotherapy or radiation. But when the cancer is manifest, I think surgical intervention, the doctor is the best judge.
Correct.
And this is one of the few cancers which is curable.
Ah,
So they should go for the modern allopathic treatment, either surgical, radiation or this. And today also the follow-up, they give other medicines also.
yeah.
But the patient can remain almost cancer-free for more than 20 years.
Yeah, they can remain, yes, that much period, yeah. But
The
here the
role
chances,
of Ayurveda, I think, as far as the breast cancer is concerned, would be mainly to minimize these adverse effects of radiation and chemotherapy.
right, yeah. And improve the quality of
But,
life. That is also
That is-
there,
Improve quality of life.
because see, when people are on that chemotherapy,
At least you can extend. up
yeah,
to-
extend at least 5 years
5 years.
period you can extend in, particularly in breast cancer.
Yes.